The Gambia and the People's Republic of China share strong bilateral relations, strengthening development cooperation across many areas, including the healthcare sector, where China is helping to train personnel to enhance Medicare capacity. Supporting the nation's premier hospital, EFSTH, with training and equipment, the Chinese medical team has achieved significant success with the collaboration assisting Edward Francis Small Teaching Hospital to independently conduct laparoscopy surgery. Dr. Abdullah Keta, the head of Department for Obstetrics and Gynecology at the Edward Francis Small Teaching Hospital, described the training as an important milestone for the Gambia, citing its exposure of nurses and doctors to modern-day technological surgeries.
This training, as they mentioned, is called laparoscopic surgery. What that means is you open keyholes on the body and do a very big operation. And that is the standard operation throughout the world. They did not only do that one, but they provide the Gambians with 3 sets of those machines. There are so much. We have to put the 3rd set in a store because we don't have a place to put it. And ever since they brought it, that is 2018 to now, 20% of our gynecology surgery are through these keyhole surgeries. And as time goes on, it's going to increase.
Mariama Bey and Dr. Keba Gassama both thanked the Chinese government for the opportunity, stating the wealth of knowledge they gain on new technological laparoscopy surgery procedures taught during the program.
Actually, this training, it looks like maybe one person was trained as a nurse, but I'm sure at the end of the day, it's going to be like the whole country, like all the nurses, because EFSTH is actually a training center, is actually a referral center, where so many nurses in different institutions come there for their clinical placement. So with the step-down trainings that we are ready to do, we will be able to help the in-service nurses in the hospital and then all the nurses as well who are coming there for their clinical placement.
Okay, the training that we went to in China actually is something that the whole world is now, embracing, because laparoscopy and hysteroscopy is one of the modern technology of how to operate patients. It entails not to cut open like our traditional open surgery. This one you have to go with a machine, a camera, a video inside, and then do operation and then come out without opening the patient. And the advantage of the operation is when the patient had that kind of operation, they spend little time in the hospital, less time as compared to the open conventional surgery. And then also you have less blood loss, minimal blood loss when you do this kind of operation than the traditional one. And then also patient can actually go back to their normal daily activity with less complication after the operation.
The Chinese consular to the Gambia, Tong Zan, assured the Gambia government of their continued support, especially in medical development.
I'm really happy about that because this is the cooperation, new model cooperation. We call it China-Gambia paired hospital mechanism. It's a very important mechanism for how to upgrade the cooperation between China and Gambia in the sector of health. And in the past years, since 2016, we have lots of cooperations in the sector of health. It is always one of our priority for the Chinese support for the Gambia. And we see that this year, we just signed the agreement on the paired hospital mechanism in February. But very soon, we kick off all the cooperations. We have the first batch of the medical supply for the hospitals. And the second one, we just invited 2 talented, 1 doctor, 1 nurse, go to China to participate in 6 months of training.
Senjin Hospital has a comprehensive capabilities that are being transferred to Edward Francis Small Teaching Hospital through cooperation for over 6 decades. The hospital donated a substantial amount of medical equipment and helped send in medical professionals who have been rendering free medical services to Gambians since the signing of the cooperative health mechanism. The goal here is to gradually enhance the Edward Francis Small Teaching Hospital, helping it to become a leading training and healthcare institution for Gambians. Awa Manneh, GRTS News.